Hi, Didn't Recommends. We have a question for you today. And our question is, when is the last time that you had any kind of chiropractic work done? And what was it done for? We would love to know that. Are you one that's never been? You have gone multiple times a week, maybe once a month, maybe a couple of times a year? Let us know down there. We would love to know that. We are talking all about how chiropractic care actually can be beneficial not only to your physical health, but also to the emotional side, the mental side of your health, and spiritual side of your health. So we
Amen.
have Dr. Jane Torrie with us. I am Carrie Breedlove. I am a licensed professional counselor here in the Denton area, and I do telecounseling across the state of Texas, Christian-based counseling with women and with couples going through life transition and life loss. And I am also the person that's doing community engagement here on Denton Recommends and bringing on a spotlight speaker. And so Jane and I have met probably sometime last year, and we have kind of reconnected and wanted to highlight what she does and get some important information out to you. So, Dr. Jane, thank you so much for being here and hanging out with us today.
Thank you, Carrie. I just really think this is a great opportunity. I appreciate it.
Yes, we're so glad that you're willing to come on and share with us your wisdom and your expertise and a little bit about chiropractic care. So, if
hmm
you're joining us, say hello down there. If you know someone else who's in this group or has a Denton based business, let them know we're hanging out right now and invite them into this conversation. We'd love to chat with you. So, tell us a little bit about just a little something about you. I know we were kind of talking behind the scenes about a couple of interesting facts about Dr. Jane. So, tell us a little something.
Well, Carrie, I graduated from chiropractic college over 35 years ago, and I have been in practice most of that time since then. And I feel like chiropractic is my gift and my calling. And I have lots of other things that I'm interested in. I have my little urban homestead that we were talking about. I have now 12 chickens in my backyard, as well as pecan trees and fig trees. And I have an in-ground garden, and I have a tower garden. So I have and herbs in some of the things in pots too. So I have lots of life around me, and that's really what I love about chiropractic, because chiropractic, the philosophy of chiropractic is that it is above, down, and inside out healing. And I believe that we were designed to heal, and that it is my role to help the body to do what it's supposed to do and help it to function as optimally as it can. That God designed us to function optimally. So when I'm working with someone chiropractically, I'm literally working with them, not on them. And it's not about kind of forcing what I think should happen into their bodies, but it's about removing interference with their bodies being able to function the way God designed them to function. So it's a real different mindset, but to me, it's like just that overflowing of life.
I love that concept of just life coming from the inside out and having life all around you. Let us know out there if you also are like Jane and you have multiple pets or your own homestead. I think you were telling me you had some chickens that have recently been added to the coop. And so let us know what kind of life that you have around you. And we would love to know about that. And so this concept of working with someone instead of what they should do, but you guys making this a partnership, I think is really interesting and intriguing.
Mm-hmm.
Tell us about how chiropractic care, I think most of the time we hear chiropractic care, and I know I typically think of the body, what it does for the body. So maybe just for those who've never experienced chiropractic care, can you tell us a little bit about what that experience is typically like for someone?
Sure. Chiropractic officially has been around for 125 years, and it started out much more as the whole person. The chiropractors would adjust the spine to affect the nerve supply that goes to the organs and the body parts, and and so it's about optimal functioning. And so helping your organs to function well, helping all of your systems to work well from a musculoskeletal approach, but affecting the nervous system. So most people, like you, maybe tend to think of, well, I go to chiropractic for chiropractic care if I'm in pain.
Right.
And
Yes.
to me, the pain may be the thing that brings people in the door, and oftentimes that's really the easiest thing to deal with. But the exciting part is going from that pain to getting the body to work as well as it can, so that people are not having slumped posture or the aches and pains, and learn how to hold their body properly and how to lift up their pelvic floor and how to sit properly and drive what position to hold their hands in for their car. So I'm always talking to people about things like that. I'm always talking to people about their exercise routines. I very regularly recommend Tai Chi and Qigong to people, because both of those help with the energy flow through the body, the meridian energy. So we have the nervous system energy flow, but then we also have a flow of energy through the body, because every cell is made up of atoms, and the atoms have electrons in them, and electrons create an energy field. So it's not just confined to the nerves. That's why you can do electrodes on the brain and read the brain waves, or you can do electrodes out on the arms and legs and get a reading on what the heart is doing, because we have this other flow of electricity within us. And oftentimes the work that I'm doing is affecting that as well as the nervous system. And God created us. We're spirit beings in a physical body. And so that's where all of this kind of has its junction. And I get to work with people to help their spiritual, physical, and emotional selves line up and all be going in the same direction.
Yeah, and it sounds like that's really key, that if we're only focusing on one part, we're sort of lopsided. I know you were telling me about the three-legged stool of the physical, the spiritual, and the emotional. And we talk about that a lot also in counseling, that we don't want to just focus even just on the emotional. Right. Oftentimes when I'm speaking with people in counseling, I'm asking them about their exercise as well and their physical bodies. And so we've come to realize all of these things work together in harmony and need that alignment, right? And
Absolutely.
Not just physical alignment, but we need spiritual alignment. We need all of those things. And so I love that you are addressing all of those. And so when someone comes into your office, what can they typically expect in terms of like a first appointment? What is that like for people?
Okay. Well, I personally schedule an hour for my initial visit with people, and I have them fill out a history form, and we actually go through the history form. So often it seems like you go to the doctor, you fill out all this paperwork, and nobody ever mentions it to you. I go through all that with people, and I ask if there's anything else. So I really look at all of those things, and then I examine them by palpation. So I have them lay face down. I palpate their spine and their neck and feel their muscles and feel what's going on in there, write all that stuff down. And then I start.
And so palpate means to feel, for those
touch
who
with
may
your
not know.
hands. Yep. And then I start working on them. And I'm what's called a full spine adjuster, which means that you might come in and tell me you have neck pain, but I'm always going to start and check your pelvis and your low back and make sure that the foundation that your neck is sitting on is balanced and level. Because if it's like this, the problem may not really be in your neck. It may just be that your neck is crooked because your pelvis is crooked. So we got to straighten the pelvis so that your neck can be straightened. The other thing about that, as I mentioned briefly, is your pelvic floor. And if people don't know how to lift up their pelvic floor, and this is men and women, it's not exclusive to women, then everything starts to just kind of sag down, and then we lift up our shoulders to try to keep everything, and then so then that may be the cause of all of this. So there's so many factors that work into this. I don't do the 2-minute adjustment. I don't prefer that for myself, and I don't prefer that as a treating doctor. So like I said, I'll start kind of at the bottom and I work my way up. I work on the cranial bones sometimes, depending on the need. Sometimes I'll work on the digestion. We're talking about the emotional state. Well, yes. If someone has a dysfunctional digestive tract, the good bacteria that should be living, I spend a lot of time talking about good gut health, but the good bacteria that we should have in our digestive tract actually make 95% of the serotonin, which is a neurotransmitter used in the brain. So if the gut's off, then how in the world can people have good mental health? And
Right.
if you're stressed and anxious, that affects your whole physical being. So it's just this cycle, and we have to
Yes.
get into every part of it to get full health.
Right. And so you're having to assess the whole person in this process.
Yes.
And tell us just a couple of reasons that people typically come in. I know I've heard of people, women who are pregnant coming in as well to receive adjustments. What's kind of the age range? Children? Who do you serve?
I adjust the day people are born. Um, I've attended several births and both help facilitate the the birth. You know, if they're having a getting stuck, I can help with that.
Okay.
And then adjust the baby when it's first born, or when I have my pregnant moms that I'm not part of their births, which most of the time I'm not, but you know, every
Mhm.
now and again I get that opportunity. But that, you know, I always, if somebody comes to me during their pregnancy, then their baby gets their first adjustment for free. And you know, if you looked at me adjusting a baby and didn't know that's what I was doing, you would just think I'm holding the baby and kind of
Mhm.
rocking it back and forth a little bit. You wouldn't know that I was adjusting. It's not a kind of thing on a
Yeah.
baby.
Right.
So, and sometimes it's not on the adults either. So, newborns all the way up. I'd say right now my oldest patient is in her 80s. So I do the full gamut of life,
Yes.
because everybody, you know, we're living beings, and things get, you know, we hold ourselves wrong, we get out of
That's
place,
right.
we have accidents, we fall down, whatever that can affect that alignment. Um, so I work with everybody, and I love
Which,
working with pregnant women. When my first son was born at home with a midwife over 30 years ago, and when I went back to work, I actually worked in the midwifery practice. So pretty much all I saw was pregnant women.
wow, how interesting. I mean, I don't know that many people may even know that those are some of the things that you can seek out chiropractic care for. You
Mm-hmm.
know, I'm wondering too, just people coming in maybe with headaches.
Mm-hmm.
Would you say
Well,
that?
headaches is something that chiropractic helps with a lot. And again, most of the time people do come in. Pain is the thing that brings them in,
Yes.
um, and that's, like I said, oftentimes getting the people out of pain is the least difficult part of the whole thing. Not always. I mean, sometimes there's stubborn pain. I'm not saying that, you know, I'm a miracle worker. The miracles come from above down anyway. But you know, there's sometimes when pain is a little bit more difficult to work with. But certainly headaches, neck pain, back pain, sciatic pain, all of those things that you see in chiropractic advertising, I work with all of those things. I just don't stop there.
Right. What is the harder thing? If the pain tends to be sometimes the easier thing, what's the harder thing, do you think?
The harder thing is if people don't realize that keeping their body well adjusted helps everything to function. It's really kind of an educational part that's hard. Of you know, yes. What I told somebody today is, some people just want to come in and have me get them to the point where the bandage isn't bloody anymore. You know,
Mm,
and some people want to go beyond that,
yeah.
and it's an education process sometimes if they just came in because of pain. Most of my people
Yes.
actually come in from referrals, so they kind of know how I work, but I always try to explain that I work with the muscles and the joints and the bones and the nervous system, and energy work and low force, and to try to really affect the entire body and help them to function optimally.
Yes, and so if that's someone that you know or yourself even that is struggling in these ways and is looking for a holistic approach to your body and care for your body, then Dr. Jane would be a great person to start with and to reach out to. I'm sure you'd be more than happy to answer questions that people have.
Absolutely.
in just this process, especially maybe if you've never received chiropractic care before, but you're kind of curious about it and want to kind of see if that's for you. And so Dr. Jane's number is there. You can screenshot this right here, 940-594-1406. And also her website is scrolling across the bottom of the screen, drjanetorrie.com. We're going to pull that up here for you so that you can see that. So this is what her website looks like. And there's a couple of different things there on the website that you can kind of just see what she's all about and the different experience and knowledge that she has in this industry. As she said before, talking not only about the body care, but what on the outside and some of the pain points, but also as well as nutrition.
Absolutely.
A lot of information that you have about that and helping people with the proper nutrition. Just as we're kind of closing here, what are some of the things that you encourage people to do in between appointments? Something that is helpful for people to maintain their health.
Well, I, of course, encourage gentle exercise. I don't necessarily say everybody's got to go do CrossFit or something, but gentle exercise. I do encourage Tai Chi and Qigong because they're so good at balancing, and they're not going to hurt a person. So my 80-year-olds and my 10-year-olds can all do it. And drinking water is huge. Drinking half your body weight in ounces of water. That's one of the biggest things. Absolutely. Good job.
Thank you so much for saying that. I tell people that sometimes too, and they're like, their eyes get huge. But half your body weight in ounces is what is recommended, and people are primarily dehydrated.
That's right.
Because most people do not drink enough water, and water affects, we are made up of a large percent of water, our brains, our joints, our organs. And so we need that to flush out toxins. And honestly, not even just for that, but just to keep everything running appropriately. We don't want to be recycling old water to take care of ourselves.
All the chemical reactions in our body either occur in water or produce water. And the tweak that I recommend for people is that you take the amount, that half your body weight in ounces, and divide it out over 12 hours. So you're not flooding and then not doing it, but you're just constantly giving your body little bits of water over the day, and that way it can get into your cells. It just doesn't get pulled out of your blood by your kidneys because the blood volume's too high.
Because it's too much, right? There's those bottles that will have the little markers where you can make sure you're hitting those, throughout the day, which I think is fantastic. This has been great. I know you also give people out your turmeric tea recipe, so if people are just dying for that, then say tea down there, and we'll make sure that Dr. Jane helps connect you.
That's right. That's right. I'd be happy to share that with you. It's a wonderful anti-inflammatory drink.
So there's so many more things we could talk about. I know that I've been talking with Dr. Jane about us doing another video later on about just trauma and chiropractic care. There's a book called The Body Keeps the Score, and it just has to do with how our body does retain memory to past traumas. And so this is something that chiropractic care can be super beneficial for. So thank you so much for coming on with us, for sharing all of your expertise. I hope this has piqued some people's interest to kind of dig a little bit deeper into this and to some of the things we've been talking about. And be sure to raise your glasses with us and have some water today. So thank you so much for being here. This has been a great chat, and I know that we'll have you back on at some point in the future as well.
Thank you very much. I really appreciate it.
Have a great rest of your day.
You too. Bye-bye.